Okay, so this is Chapter 2, Quality Assurance and Legal Issues. Again, remember, you can pause the video at any time you need to review a slide or take notes or anything like that. Okay, so these are the objectives for Chapter 2, so take a minute and review these, familiarize yourself with what we are going to try and accomplish this chapter. Okay, so the following slides are going to discuss various agencies who set standards and policies that labs and other health industries follow to help regulate and ensure the quality of healthcare being provided. Take a few moments to review the Joint Commission, including Sentinel events and national patient safety goals. So, as I mentioned, this slide is talking about the Joint Commission. It is a voluntary, non-governmental agency. Voluntary meaning you can participate in it if you want as a lab. Its main function is to improve healthcare for public through evaluation. Okay, so here you can see some of the program-specific screening criteria for meeting their standards. This slide talks about the Sentinel event that I mentioned. It helps organizations identify safety issues and prevent them. If a Sentinel event occurs, the organization should perform a thorough and credible analysis of the root cause, put improvements to reduce risk into practice, and monitor improvements to determine if they are effective. And the Joint Commission does put out national patient safety goals for all labs and facilities that participate in their certification. These were the patient safety goals for 2010, but they do tend to go from year to year. Always identify patients correctly. It's one of the main functions, most important things you will do in your job. The College of American Pathologists, or CAP, offers proficiency testing and continuous lab inspection designed just for pathology and lab services. It is an organization that ensures the accurate results for patients. So pretty much any test that a lab runs, any test, throughout the year they will be given known standards from the College of American Pathologists, and they are expected to get a result within a certain range of the known result. If they don't get that, then they have to take steps to correct their methods and figure out why they're not getting the results they're supposed to be getting. Okay, so like I said, it is an accreditation institute for labs. They also will, every 2 years, will do an on-site inspection where they come to the lab and ensure that things are being done as they should. Organization is good, your procedures are good, your staff is accredited like they should be, that kind of stuff. Okay, so the Clinical Lab Improvement Amendments of 1988, also known as CLIA 88, was an act of Congress that established standards for all labs. And these are the standards that were addressed. And so the next few slides are going to talk about some of the other quality assurance agencies. So go ahead and check those out for a little bit. This one is the National Accrediting Agency for Clinical Lab Sciences, also known as NACLS. And this is an authority on educational quality. So they're more in control of the education systems that prepare people to work in labs, like the one you're in right now at Amarillo College. So this is quality assurance. It's a program that guarantees quality patient care by tracking outcomes through scheduled reviews of the following elements of patient care. And there you can see what those are. QA is run in every lab to ensure quality, usually assigned to a specific employee of the lab called the QA officer, who then will give responsibilities to other people in the lab. So as far as a QA indicator, these are the things that have to be met to qualify as a QA indicator. As far as quality system essentials, the most important thing about this to remember is there are 3 processes of path workflow: the pre-analytical, the analytical, and the post-analytical. Essentially, most of the work you're going to do is going to be pre-analytical, which is what happens before the test is run. The analytical part is the actual test, and the post-analytical is anything that occurs after the test has been run. So the rest of these slides go into detail about various aspects of QA. There's a threshold value, which is the level of acceptable practice beyond which quality patient care cannot be assured. I'm just going to quickly go over these a little bit. You don't want to hear me read all of this, so just make sure you take some time to review this stuff yourself. Quality control, or QC, is a component of a QA program. It uses operational checks to ensure procedures are performed correctly. Quality results when standards are met all the time. So quality control, again, in a lab, every test that we do has QC done on it, meaning that we check the test being run against known results, and we have to get within a certain range of that result, and that tells us that the test is working correctly, so that we're not putting out inaccurate patient results. Okay, and then again, these are just some more things to do with QA that you need to make sure you're familiar with. This is the patient's record. Okay, so then these next few slides are going to discuss various manuals that must be maintained within a lab. These include lab procedure manuals, which states the policies and procedures for each test practice. Every procedure that is done in a lab has a policy or a procedure, and it must be available to all lab employees. There's a safety manual, which contains procedures related to chemical, electrical, fire, and radiation safety, what to do in a case of an exposure, a disaster, and how to handle hazardous materials. There's also an infection control procedure, documenting on how you should hand washing and precautions when dealing with patients or handling specimens, and procedures to implement after exposure incidents. Okay, this slide is talking about risk management. So the risk management is the identification and the minimization of risks to patients and employees. There are the steps right there towards accomplishing that. Risk management is also a vital part of the lab. It's usually performed by a separate department within the facility. Okay, so the final slides of this chapter are going to discuss various legal issues within the healthcare industry. Please review these, paying special attention to the various forms of consent, including a patient's right to refuse consent. Patient doesn't have to do what a doctor wants them to do. They have the right to reject that care. So again, if you need to pause through some of these to check these out. I'm going to scan through, coming up to the important parts for you guys. Informed consent. That implies voluntary and competent permission. You have to give adequate information to a patient in non-technical terms, and it must be obtained before you begin the procedure. Express consent should be specific and cover all procedures to be performed. If you get a verbal consent, it should be followed by entry in a patient's chart. There's also written consent gives best possible protection, must be signed by provider and patient, and it must be witnessed by a third party. Implied consent, that's where a patient's actions imply consent. So this is the one you'll experience most of the time. Like when a patient lays their arm down on the chair for you to draw, that's implied consent. HIV consent, the client must be advised on the test and its purpose, how the test will be used, and the meaning of its test in specific instances for HIV consent. Consent for minors. A minor cannot give consent for medical treatment. A parental or guardian consent is required. You can be found guilty of assault and battery if you do not follow this, if you do not get proper consent for minors. And as I mentioned, a patient does have a constitutional right to refuse medical procedure. It usually must be verified in writing, but just be familiar with the fact that they can refuse medical procedures. Alright, so this is the litigation process. Fun reads. Just make sure you're familiar with how that goes about. And that's the end of chapter 2.